Amyotrophic lateral sclerosis. Formerly known as Lou Gehrig's disease, ALS is like a silent assassin for the nervous system. It sneaks in, slowly taking away your ability to move, speak, and eventually breathe. Imagine you want to tell your hand to lift a glass, but your brain just can't communicate with the muscles in your arm anymore. ALS wipes out the motor neurons that control muscle movement, and without them, your body can't function properly. While your mind remains sharp, you slowly become a prisoner in your own body. Most people with ALS die from respiratory failure within 3 to 5 years of diagnosis. What's truly terrifying? There is no cure. Doctor. Stephen Hawking lived with ALS for 55 years. He was an inspiration to many, but sadly, his intelligence and determination were no match for this deadly disease. Lupus. Lupus is like your body's defense system going rogue. Normally, your immune system is the hero, fighting off invaders like viruses and bacteria. But with lupus, it's as if the body's soldiers turn on their own army. This friendly fire leads to a full-blown internal war, attacking healthy tissues and organs. Autoantibodies, proteins meant to protect, become the villains. They target everything: skin, joints, kidneys, blood cells, even the brain. While we know genetics and environmental triggers are part of the cause, what kicks off this chaos remains a mystery. Lupus symptoms? They're as unpredictable as the disease itself, ranging from intense fatigue and joint pain to skin rashes and fevers. And if left unchecked, lupus can lead to serious complications like kidney failure and heart disease. Currently, there's no cure for this chronic and potentially life-threatening illness, but with proper management and treatment, many people with lupus can lead full and productive lives. Pancreatic cancer. Pancreatic cancer is the definition of a silent killer. It lurks undetected deep within your body, often showing no symptoms until it's in the advanced stages. By the time you feel the weight loss, stomach pain, or jaundice, the cancer has likely spread beyond the pancreas. This tiny organ, which sits behind the stomach, plays a huge role in digestion and regulating blood sugar, but when cancer strikes, it does so viciously. Pancreatic cancer has one of the lowest survival rates of any cancer. Only about 10% of patients survive beyond 5 years. Even with surgery, chemotherapy, and radiation, it's incredibly hard to beat. Once the disease has a foothold, the clock is ticking. And with the majority of cases being diagnosed at a late stage, finding effective treatments is an urgent priority. Tuberculosis. Tuberculosis is an ancient disease, but it's still a killer in modern times. TB infects your lungs, but it doesn't stop there. TB can spread to other organs like the kidneys, spine, or brain. It's caused by bacteria that lie dormant in the body, waiting for the right moment to strike, usually when your immune system is weakened. When TB becomes active, it leads to a persistent cough, night sweats, fever, and weight loss. The bacteria multiply, slowly eating away at your lungs, leaving you gasping for air. Without treatment, TB can be fatal, especially when it spreads beyond the lungs. The scary part? Drug-resistant strains of TB are becoming more prevalent, which makes treatment even more challenging. With timely diagnosis and proper treatment, TB can be cured, but the key is catching it early. Laryngeal cancer. Laryngeal cancer attacks your voice box, but it's not just your voice at stake, it's your life. Caused mostly by smoking and excessive alcohol consumption, this cancer starts in the tissues of the larynx and can spread to nearby lymph nodes or other parts of the body. Early symptoms might just be a persistent sore throat or a change in your voice, but as the cancer grows, it can make swallowing and even breathing a struggle. In advanced stages, it often requires aggressive treatment, including surgery to remove part or all of the voice box. The emotional toll is immense. Not only are you fighting for survival, but you may also lose your ability to speak. If untreated, laryngeal cancer can be deadly. The good news? With early detection and treatment, the survival rate can be as high as 90%. Mesothelioma. Mesothelioma is the grim result of exposure to asbestos, a material once commonly used in construction. Inhaling asbestos fibers can cause cancer to develop in the lining of your lungs, heart, or abdomen, sometimes decades after exposure. It's a slow, relentless killer. Mesothelioma doesn't just attack, it invades the spaces where your organs are supposed to function. Breathing becomes painful, your chest feels tight, and fluid builds up around the lungs, squeezing them like a vice. Once mesothelioma takes hold, the prognosis is usually fatal. Treatments like surgery, chemotherapy, and radiation can extend life, but the survival rate remains low. It's a disease that devastates not only the patient, but the entire family. While asbestos use is now heavily regulated, cases of mesothelioma are still being diagnosed, underscoring the importance of continued awareness and prevention efforts. Pulmonary fibrosis. Imagine trying to breathe with lungs made of scar tissue. That's what life is like with pulmonary fibrosis. Over time, the tissue in your lungs becomes stiff and thick, making it difficult for oxygen to pass into your bloodstream. Every breath feels like an uphill battle. The cause is often unknown, but it's like your body decides to build up scar tissue inside your lungs for no reason. The symptoms start subtly, maybe a persistent dry cough or feeling unusually tired. But as the disease progresses, it feels like your lungs are being encased in stone. There's no cure for pulmonary fibrosis, and most patients don't live beyond 5 years after diagnosis. Without a lung transplant, the outlook is even more dire. It's a disease that takes away your ability to breathe and ultimately, your life. Malaria. While malaria is often associated with tropical and subtropical regions, it is one of the most lethal diseases globally, killing hundreds of thousands each year. Malaria is caused by Plasmodium parasites, which are spread through the bites of infected mosquitoes. Once inside the body, the parasites attack red blood cells, causing high fever, chills, and flu-like symptoms. Without treatment, malaria can lead to severe anemia, organ failure, and death. The disease disproportionately affects children in Africa, where healthcare access is limited. Despite ongoing efforts to control and eliminate malaria, it remains one of the world's top killers. Necrotizing fasciitis. Known as the flesh-eating disease, necrotizing fasciitis is a rare but aggressive bacterial infection that destroys the body's soft tissues. It spreads quickly and can lead to septic shock, multi-organ failure, and death if not treated promptly. Even with treatment, amputation may be necessary to stop the spread. This deadly infection can start from something as simple as a small cut or scrape. If left untreated, it can ravage the body within hours, leading to death in a significant number of cases. Early recognition and immediate surgical intervention are crucial for survival. Pulmonary hypertension. Pulmonary hypertension is high blood pressure in the arteries of the lungs, and it's much deadlier than it sounds. The blood vessels in the lungs constrict, causing the heart to work harder to pump blood. Over time, this can lead to heart failure. Pulmonary hypertension symptoms include shortness of breath, chest pain, and swelling in the legs, but it's often misdiagnosed as asthma or other common lung conditions. Without treatment, the condition worsens, and death is inevitable. Even with treatment, the survival rate is grim, especially for those diagnosed in later stages. Cholera. Cholera spreads through contaminated water and can kill within hours due to extreme dehydration. The bacterium Vibrio cholerae causes severe diarrhea and vomiting. Outbreaks are often tied to poor sanitation, particularly in areas affected by natural disasters or conflict. Without rapid rehydration, the loss of fluids becomes fatal. Cholera remains a constant threat in parts of Africa and Asia, despite being preventable with clean water and sanitation. The lack of access to basic health care means that outbreaks can wipe out entire communities before medical teams can intervene.